Speaking of hysteria, cuts to Medicaid and food stamps have freaked everybody out right now, but apparently this cuts both ways. Cheesy pun intended. Nat, can you pull up that clip of Bessent and Warren, please? Take a look.
You don't want to answer the question.
No, Senator, I am answering it.
No, you're not.
And what I want is for Medicaid to be used for mothers and children as it was meant, not for 1.4 million illegal aliens, not for able-bodied people.
You don't want to answer the question.
Okay, Lindy, go ahead.
Well, okay, this situation has been explosive, to say the least, because Democrats are accusing Republicans of throwing millions of Americans off of Medicaid and Medicare, and which is just not true, because work requirements is not depriving people of care. Work requirements is ensuring that, as Bessent said, it goes to people who actually need it, not people who are able-bodied and able to work a job but choose not to. And honestly, 80 hours a month is not, asking for too much. And there's something to be said. Work requirements is something that Democrats embraced during the era of Clinton, but suddenly it's a bad idea and a bogeyman because Trump wants to do it. And Mike Johnson, not just Bessent, but Mike Johnson also is hammering away at the fact that Democrats is dangling the prospect of Medicaid, the prospect of driver's licenses, the prospect of social, all these benefits in the eyes of legal aliens, and thus attracting them to these blue heavy states like California, like New York. And then they blame Republicans for saying, are you doing this? This goes to a topic we're going to discuss later. Are you doing this just to juice up the population figures for the upcoming census? I don't think it's much of a, it's not a stretch when they constantly shove these benefits down the throats of these illegal aliens. And it's basically saying, like, it's shoving out a welcome mat and saying, come here.
Least of all that, what about like the $10,000 prepaid card that they
there
got
you go.
when they arrived?
Well, wait, stay on point,
no,
though.
sorry, I'm just saying.
A lot of these are
She
interconnected.
is correct. It makes sense. Why it's connected is because the incentives have been intentionally contrived to bring in these type of people. The right incentives in this country do not exist to make sure that we have the right immigration process and policies.
But wait, hold on. Stay on the cuts to Medicaid and food stamps right now. I agree with you, and we're gonna get into that in another show. But right now, people are outraged. I can't remember how many hundreds of thousands of people are going to lose health care because of this. And no one really understands why they're losing health care, or at least the people that I end up in arguments with don't understand it. And I'm just trying to explain it beyond the fact of really understanding for myself whether it's considered good or bad.
But these are work requirements. It's a choice that they make.
I'm not suggesting you're wrong, but Doc, what becomes of this then, do you think? Who gets hurt by it?
All I know is I now start to present myself as a time traveler. I come from the past. I traveled into the future to deliver messages in the present. Whenever I give public lectures now, I'm always thinking that in my head because I have very strong opinions about addiction treatment and things based on decades of experience that have been sidelines. So I'm here from the past to tell you about how things should work. But that's, But I'm going to say some words that I did not expect to say in 1996.
Clinton was right.
I miss Bill Clinton. I really miss Bill Clinton.
I saw you react when I brought it up.
I really miss Bill Clinton because he had a massive reworking of the welfare system based on this principle.
Yeah.
That you just have to do. Work is good. It's important. People need it. And we've set up a system that denies the reality of the human experience, including incentives and what people need in order to be healthy and good and engage in the world and be a part of society. It's okay to ask people to do something.
Exactly.
To get their,
okay,
to get their
it's
privileges.
not just work requirements. They can go to school.
Yes.
They can do community
it is,
service.
I cannot say this.
Are we going to litigate undocumented, though, or are we going to talk about cuts to these two programs? Because they are two separate...
I'm just saying that asking people to work, asking people to go to school or volunteer in their communities, it's not an imposition. It also just helps bolster their sense of humanity and dignity. It's good for the community. It's good for them.
It's good for them.
And by the way, I love what you brought up about the time traveling, because literally they said this. Democrats wanted this. Even during the era of Obama. Now it's like just like so many other issues like tariffs and whatnot. They are staunchly against it because Trump has adopted it.
So that's hysteria.
Based on studies of Medicaid recipients at this current moment, no one who's on Medicaid, with the exception of undocumented immigrants, we can talk about that later, but no one who's currently on Medicaid, who gets Medicaid, qualifies for Medicaid, would be kicked off of the system under this policy. However, I think it's really important. Like, look, sometimes we get into like conspiracies, right?
For sure.
And so I want you to think about what's actually happening behind the scenes, like what the motivating factors are of that particular focus on cutting Medicaid. Right now, that big, beautiful bill, think about what it does, right? It has major tax cuts. It extends the tax breaks for working class Americans, yes.
The 2017 tax cuts.
Yes, the 2017 tax cuts. But it also disproportionately benefits wealthy political donors who want additional tax cuts. They want to save more money by not having to pay the federal government their taxes. So right now, with a $37 trillion debt that we're dealing with, and the fact that we're paying $1 trillion a year just to service that debt, Republicans are like, oh my God, I want to do this favor for my donors. I mean, that's what they paid me for in my campaign. So what can we cut? And they're hyper-focused on things like SNAP. Those are the food
I wanted
stamps.
to get to that one.
That, and also Medicaid. And honestly, those cuts are not in any way, shape, or form going to even come close to paying for the tax cuts. And I just think it's messed up because, look, I'll give you some numbers. I'll give you some specific numbers. If Republicans think this isn't going to hurt them politically, they've got another thing coming. Because at this current moment, there are 80 million children, senior citizens, people with disabilities, parents and adults without dependents relying on Medicaid, okay? When it comes to Republicans, more than 60 House Republicans represent districts with higher than average Medicaid enrollment. I think that there is this defamatory claim about Americans, low-income Americans who need these programs, where people think that they're like bums who don't want to work. There have been studies into this. The majority of them do work. Those who, yeah, and those who don't work.
Then wouldn't they not get cut? That's where I get confused.
Okay, I'll answer that question. I'll answer that question. So
Okay.
I don't have a problem with the work requirements. And in fact, the way that that provision is written, it's not extreme. However, what ends up happening is, think about the number of elderly people or people who might get discouraged by the process of proving that you're working, right? You have to set up a whole bureaucracy in order to do the checks to make sure this.
Why is it really that difficult?
Yeah, they've done this before. They've literally done the same policy before, and it ended up kicking a ton of Americans off of Medicaid. Because look, for us, it might seem super simple to like, oh, whatever, I'll log into whatever this thing is, I'll report, and I'll provide evidence that I'm working. But there are a lot of people who don't have either the capability or even the computer and technology to do that. It becomes an obstacle that ends up kicking people off of the system, even though they qualify.
But that is similar rhetoric to saying that people who don't have voter ID because they don't know where the local DMV is.
Yeah,
it sounds like
I know. That sounds super patronizing and ridiculous. And I would agree that it applies to, you know, Medicaid and this policy that they're trying to pursue, except it's already happened. And it showed that a lot of Americans who do, in fact, qualify for Medicaid ended up getting kicked off the rolls as a result of that policy. I do not like the idea of my fellow Americans who need this social safety net getting kicked off the system just because these wealthy donors want these tax breaks and they're looking for savings. By the way, one other thing. I have to add one other thing. Right now in the Senate, where they're debating the big, beautiful bill, you want to know what Senate Republicans specifically are focusing on cutting out of the bill entirely? No tax on tips, no tax on overtime.
That would be catastrophic.
It will be catastrophic.
That would be catastrophic.
So look, guys, whatever you think about the social safety net, I just really need you to think about the motivations for why these provisions exist in the bill. That's all I'm saying.
So you're saying it's simply, at the end of the day, they're doing this to balance the budget or to give an illusion that the balance is the budget is going to be balanced.
Exactly.
In reality, it's not really going to yield any results, and this is all just a guise to push through the big beautiful bill.
Well,
yes,
that's your position, essentially.
I'm going to Dr. Drew after this one. Go ahead.
The counter argument is that asking people to file the proper paperwork is not too much of imposition, just like when you want to vote, it's not too big of imposition to, present your passport. Exactly, go to the DMV, find a way to prove that you are actually a citizen. And also, how do you give tax cuts to people who don't pay taxes, the 40% who actually don't? So it's not too much to ask for integrity in the system to ensure that everyone who's actually on the program deserves to be on the program. I actually don't think it's like it's the essence of what America used to be, like personal responsibility. Because right now we have a humongous welfare state and just simply unsustainable.
We do have a humongous welfare state that overwhelmingly benefits pharmaceutical companies that Medicare is unable to negotiate
I'm
with.
on that.
I know, but like if we're going to have a talk about our government resources getting wasted, which, by the way, there is a lot of waste, there is a lot of abuse, the fact that our Medicare system cannot negotiate pharmaceutical drug prices, I mean, that is an injustice. And if we had changed that, that would save far more money than
Those are the pharmacy benefit managers in the middle that work for the big insurance
But nothing's being done about that.
There was an executive order on that.
I know, but you can't do it through executive order.
I understand, but it's starting. It's moving that way.
You need, unfortunately, you need Congress, and Congress has no interest in legislating.
Medicare and Medicaid.
Yeah.
It is specifically for that. The one concern that I took away from that, and this is from Brigham Bueller, Doc, who I'm sure you're familiar with through the Maha channels, is that insurance companies can then turn around and say, okay, well, who's got the lowest cost for, let's say, insulin? All right, in that country, it's $10. We're going to make it $20. Now we're meeting the lowest cost America.
So they're going to increase prices for everybody?
It's only, but anyway, we are working on it. There was an executive order to start to deal with it. I would ask you this, because on one hand, I agree with the girls. I'm like, you should have to work. It's free.
And by the way, let's remember what work is. It's 80 hours per month. That's what they're asking.
I know. But on the other hand, you're giving me the data saying, yeah, but it didn't work.
Right.
And vulnerable people are exposed.
When was that?
This happened, I think it was under a previous Republican administration. I don't remember the exact dates, but it was also challenged in the courts, and the courts threw it out. So there is going to be legal challenges in regard to this policy. And again, there's a false assumption that people who are qualified for Medicaid at this current moment are just lazy bums who aren't working, when again, multiple studies show the majority of them are working. Those who don't work are taking care of elderly parents. Hold on, are taking care of elderly parents, or they're going to school, meaning that even under this provision, under the big beautiful bill, they wouldn't get cut.
Right, okay.
Everyone who's getting Medicaid right now qualifies for Medicaid. It is
for the most part.
For the most part. I'm sure there's like a few isolated incidents of fraud, right? There's definitely a lot of fraud in our Medicare system with these like adult daycare centers that end up charging, like, focus on that. But focusing on the most vulnerable Americans who need help.
Oz is on that. He's on the Medicare fraud. But so I'm the only one here that uses these systems. So both I'm a Medicare patient and I've been a Medi-Cal provider for many, many, many years. Medi-Cal is Medicaid, just in California.
Yep.
It's a horrible system. It doesn't work. Providers can't use it because it's just impossible. You don't get paid for anything, essentially. Anybody that needs Medicare gets it. And if you can navigate the Medicare system, you can navigate the Medicaid system, trust me. So Medicare is insufferable online. I can barely find my way through it. And for elderly patient is a legitimate problem. They don't know how to do an email.
Right.
So, but they do it. Figured out there are armies of people ready to help them. Same thing with Medicaid.
Isn't that what navigators are for?
There are armies of people ready to do it. So they get through the system. They find a way. See, when you say elderly, you're talking about Medicare, Medicaid, two systems. Both.
Right. No, I know
they get the Medicare automatically.
Right.
And also, it's complicated. This gets a little bogged down because many of the people who aren't working and are on Medicaid are really mentally ill. It's like seriously.
Yes, exactly.
And they're not. They're on, and they may be on disability also. So there's
I didn't consider that component at all.
Able-bodied would also include taking into account psychiatric capabilities, mental health.
Yeah, exactly.
All of those
No one's
things.
asking.
It gets in the weeds. It gets very complicated. It really does.
I mean, I'm sure it could. I completely agree with you, Anna. We do need to be able to provide some safety net. My issue, and especially coming from Australia, where there's private health, but it is largely socialized healthcare system. And we're getting to the part now, and I've seen people come at me for saying this before, but just fact check, do your research, especially outside of the major cities. People are dying, waiting for ambulances now.
That's true.
Like, people are literally not getting the care that they need because they've become so reliant on the government. The budget is not balanced, and they don't have the same resources to throw towards it. Yes.
Oh, yeah,
Could we end up in that same position if we bring in all of these people, provide so much socialized care without proper checks and balances?
Listen, the way insurances operate now and the way socialized medicine operates, they want, not like they desire it, but they want you to die waiting for care rather than delivering the care.
What?
Absolutely.
Can you explain? Can you elaborate on that just a little bit? Because I got destroyed in the comments for saying this previously in one of our shows.
So let me give you
treat
two. Do you really want to get into the weeds on this?
Let's do it.
course.
Let's do it. I do want to get to.
I think that's a
few of the
really
other ones,
good
but
point,
let's do
though.
it.
Let's-
Let's do it.
let's
If
wrap
you've
up
got the
with
time,
that.
So
Doc.
I have two stories. One was I ran a very large drug treatment center for a long time, and early in the days of the HMOs, when they were getting going, there was a high-quality physician that set up one and was working on it, and we were seeing his patients, and they were mandating that these are alcoholics. They were mandating discharge at 3 days. They were relapsing. Finally, I called this guy. I go, look, my staff is demoralized. We want to help these people. You name your price. I will care for the patient across our services. We'll do outpatient services. We'll do all kinds. And he goes, no, I just want a 3-day detox. I go, what do you mean you think they're not going to go out and relapse again after 3 days? He goes, oh, no, they may relapse. But if they relapse 3 times, then they're no longer my concern.
And these are Medicaid recipients?
This is a HMO.
Oh, okay.
And he literally said these words, I'll never forget it. I'm an insurance agency now, not a social agency, so I can't tell you whether that's good or bad. I just was like, it was the most unbelievable moment for me. So that was one moment.
Insurance agencies.
That is devastating.
Insurance agencies, though, are behind.
Now here's this. So now
Medicare,
let me give you
Medi-Cal,
another one.
Medicaid.
This is a little more involved. So,
Same thing.
So as time went on, all the insurances started mandating people leave the hospital. But before they were ready, some review doctor in Chicago would be reviewing the case, and they'd go, "You patient, get them out. You don't have to meet the criteria." What criteria? Our criteria. Okay. I sit with the patient. I go, "You're going to come into some real expense here. You're an addict in trouble. I don't want you to have to incur that. Let's figure out some place where we can put you and get some care for you." I'm not ready. I'm in withdrawal. I'm suicidal. I don't want to go. I go, your insurance company is not going to pay after today. I'm going to call my insurance company. Call the insurance company. The insurance company goes, oh, Mrs. Smith, if Dr. Pinsky would just tell us what you need, of course we'd provide that. They don't tell the patient, you have to meet our criteria. I explain the criteria thing. The patient leaves. Let's say they go home and commit suicide. The insurance company then goes, we don't practice medicine. There's Dr. Pinsky's order right there.
Wow.
He discharged the patient. We don't practice medicine.
You're talking about
So I've been
exactly.
in situations like that. I
Yep.
made a complaint to the California Insurance Commissioner. Next thing I know, I'm getting called in by the hospital administration, freaking out because the insurance company is going to decertify the entire hospital if I don't shut up.
Wow.
Can I strongly recommend everybody watch an interview with Brigham Bueller? He explains the evils of big insurance, so much so that when doctors order preventative tests, they will whip up the DOJ to go investigate that doctor for healthcare fraud. It is insidious. And what I was telling you briefly earlier is that it is these same exact insurance companies, Medicaid, that is a United Healthcare, Blue Cross, same
Well,
thing.
United actually is one of the biggest providers of Medicare Advantage. And there have been a lot of issues with that where they do not
disaster.
authorize.
Yep.
But that is the type of situation in which it's publicly funded but privately run. And so they look to basically deny authorizations, whatever, to increase the amount of federal money they can put in their pockets.
Exactly.
Like, that's a huge problem.
You got
Can we
it.
slightly bring
you,
this-
you nailed it.
Can we bring this slightly back to the original topic of SNAP cuts and Medicaid cuts, in that we got to remember why we're here in the first place, and that's just the albatross of national debt. It is we are suffocating under this tremendous burden. We pay upwards of $1 trillion each year just to service our interest, which is just astounding and breathtaking. Like, how much longer can we remain on this trajectory?
Not much.
Exactly, and I just want to say, just because you say that fraud on Medicaid isn't substantial doesn't mean that we don't go after it. And I agree that the big beautiful bill has a lot of issues. Like, they cut I'm against cuts to solar credits. I think we should have them. I think we should cut subsidies to companies like ExxonMobil. I don't think that should happen anymore. But just because there are bigger cuts elsewhere doesn't that mean that we should also just jettison cuts to
In
Medicaid.
2017, I do have a problem with it because I think what they're prioritizing here in terms of cuts says everything you need to know about our congressional lawmakers and what they prioritize, right? So I find it hilarious. They're like, oh my God, we're in so much debt, when the yearly defense budget gets passed with increased defense spending with no debate at all. Like, you want to have a talk about what's contributing to our debt? The Medicaid system is like far down that list compared to how much we spend on defense and other things. The lack of revenue that we're going to bring in as a result of the major tax cuts to the rich. I remember in 2017, Trump said, look, I want to simplify the tax system. So I'm going to do these corporate tax breaks, right? The corporate tax rate was 35%. He's like, I'm going to lower it to 21%. However, I'm going to close the loopholes, the corporate tax loopholes. He didn't do that. And that created a situation in which companies as profitable as Amazon were able to get away with paying zero in federal taxes.
It's terrible, but our system is binary. It's not like, we're not comparing ourselves to God. We're comparing ourselves against literally the Democratic Party. And because it's not, you know what I mean? It's not the ideal. We can't have the ideal or the Republicans. It's basically the Republican plan or the Democratic plan. But I do want to say that let me give you the alternative. The alternative is somebody like Joe Biden, who
shouldn't be though, Wendy.
But it's just reality, though.
Issue.
It is a systemic issue.
I'm just describing reality. Let me tell you what the Democrats did under the Biden administration. They withheld SNAP benefits, food stamps, by the way, for people who aren't clear.
This is fair.
They withheld food stamps from schools and public school students who don't have much. They withheld that from schools who refused to allow biological males in girls' bathrooms. Okay, and I sent you that. I sent that. I sent Nat that link. Or
Joe, did you see that? I didn't know that. I didn't see that.
Wild.
I appreciate you pointing out that hypocrisy.
Yeah.
I think you're absolutely right. And the fact is, like, everyone's running around being outraged, but yet their own team pulled this. But you know, the part that's so frustrating, and it's something that we were all talking about before the show started, is like, you said this about Trump. You were like, listen, some stuff's good, some stuff's bad. Some stuff is like, I don't know. I mean, and they're all kind of like that. And they're incentivized similarly.
He proposes things that I think could be good. So when you're talking about closing the corporate tax loophole, I'm all for it, but you have to deliver. I'm in favor of the car loan interest rate deduction, because that's going to help working people. The question is that on the chopping block in the Senate right now? Because what they're eyeing in terms of cutting, provision-wise, are all the different provisions that help working class Americans. So you do that in addition to cuts to the social safety net, you're going to make a lot of enemies, number one. So if you're thinking political strategy, Republicans better wisen up. But the thing is, we have so much corruption baked into our political system. And so there's this like tug of war between constituents and corporate donors.
It's also bigger than corruption right now, because we have to look at the macroeconomic situation right now. We are in the era of tariffs, and we're still in that 90-day period, and Trump is feeling nervous. He's here. He's getting called up by his big donors, these corporations. I'm just explaining what's happening here. These walls, like people like Jamie Dimon calling him up saying, stop the tariffs right now. So he's already under pressure to cave to these corporate interests. It's going to be impossible for him to close any corporate loop. This is not a prescriptive statement. I'm just explaining.
No, he's not going to close corporate loopholes.
I mean,
that was never a priority. Let's keep it real.
They put out the Maha report. And it's like, environmental toxins, points right back to Big Ag. And Big Ag went bananas. All of a sudden, it's like, well, you can keep your illegal workers and don't worry about your chemicals, glyphosate. We're going to take that off of this bill in Texas that was going to get banned on. And all of a sudden, concessions. And just to speak on something that I understand uniquely with regard to things like SNAP, we spend $500 billion, I think, over the course of a decade on these GMO crops. That's our money, our subsidy dollars to Big Ag. And then we spent 40% of Coca-Cola's income comes from our money, our subsidy dollars via SNAP and the Women and Children program. And so if you took these, what ends up being trillions, and maybe redistribute it to the people in a different way, the system is just, where do we net out here? Give me something hopeful.
Well, hey, the House passed the rescission bill.
A bright light.
The House passed the rescission bill. It's going to the Senate.
She means
see
the
what
Doge
cuts they
cuts.
make. All of the cuts, that would be something that could substantially help to balance the budget. It's a little white pill.
The good news I'm taking away is we're not Australia.
Okay.
Yeah,
Yes.
that's the good news.
All
Hey,
right.
that's the good news I'm
another-
taking away.
I
That's
have
why
another
I live
glimmer.
here. Okay, that's why I live
I
here.
have another ray of hope, kind of.
All right.
And we'll
Last
get
ray
in
of
on
hope,
this.
and then we'll move on.
So right now, RFK Jr. is trying to ensure that all the SNAP benefits don't go to soda and candy and junk food.
Yeah.
I actually think that's a really welcome development.
Yes.
But thank you, Dr. Drew.
Yes,
But
I would agree.
Democrats are up in arms
Yep.
saying, you know, this is like patronizing. This is,
Racist.
exactly.
Ableist.
And-
It shouldn't matter then. It shouldn't matter. If it's patronizing, yeah, they shouldn't need that encouragement, so it shouldn't bother them at all. Let's just do it.
Exactly. But also, we have such a, we haven't even talked about the obesity epidemic in this country.
But it's
and
all
the chronic
tied, though.
Right.
That's what's. I think it's.
I mean, the food
80%
pyramid
of the
and-
people on SNAP are on Medicaid by design, and there is a vast divergence with the people that are on SNAP in the same demographic with those that aren't. Who's on Medicaid? Obviously, the ultra-processed foods that it subsidizes makes people sicker.
Right, and we all end
Common
up paying
sense
for it because if
dictates that.
someone ends up in the emergency room and isn't on insurance, who foots the bill? We do. So we are all in this together, folks. And I know it's sometimes easy to forget that in this era of extreme division, but we all end up footing the bill for everybody. We are
Well,
one team.
I would argue that that's one of the important steps forward lately. Is I feel as though what was Musk's organization called again? The
Doge.
The
Department of Government
the Doge
Efficiency.
got people thinking about what do I want my taxpayer dollars
Yeah.
to be used on. I mean, we didn't think that way for the last 20
Right.
years. And we now people are going, oh, now somebody said 40% don't even pay taxes, but even there began to realize that this could be done more sanely than it
Right.
had been done. In particular, all the corruption and USAID and
There
all the kind
is.
of
There's-
grift and everything. People are like, they're outraged with how
I
our
mean, the
government
food
behaves.
pyramid is a joke, and it's not healthy to
100%.
load up on carbs, and it's just ridiculous. So I know that corruption exists. There's no question about it. But
Extreme corporate capture.
definitely. But to your point, Lindy, I agree. I mean, the most expensive healthcare system to have in this country is one in which people who don't have healthcare have no choice but to wait until they end up in the emergency room, and that ends up costing a lot more. So we want to make sure
Again,
people.
that's complicated too because people on Medicare only use the emergency room for their health care.
Well, that's a problem.
So it's like
Medicare or
a big old-
Medicaid?
Medicaid, I beg your pardon. It's a big old mess. The thing about MAHA, one thing that bothers me about MAHA is they really aren't talking about the healthcare system. They're talking about
Yes.
helping people get in a condition where they don't need the healthcare
Yeah,
system.
prevention.
We really haven't even scratched the surface on the healthcare system yet.
I agree.
Thank you so much for watching Her Take. If you like the show, can you help us out by subscribing to the channel, clicking the notification button, sharing, commenting, joining the conversation? It helps us out a ton with the algorithm. We appreciate you.